So I want to talk about prevention. That is to say, in retrospect, could we have prevented some of the exposures that people had at ground zero? Obviously not on 9/11 itself, but in the aftermath, and it took 9 months to clean up. And in particular, looking ahead to the next catastrophe, what can we do different so that we reduce or eliminate people's exposure, and so they don't have to become sick? This is kind of a hard topic. And I have my own thoughts about that, but I'd like to hear your thoughts about what we might do differently next time.
Well, again, I think because we've looked at these effects, we've learned something. And what we learn and what we now tell people won't be a message from some out-of-touch expert, but it'll be a message from the FDNY family. And that's what this program has done. So there's nothing that we're going to be able to do on the first day of the next disaster. We'll be better trained, we'll have better equipment, but our members are going to be there, all right? And if their equipment fails, they're going to still be there. And the rescue operation is hopefully going to have the perfect protective equipment, but it will be the primary thing in their minds. So I know and I agree with you that on that day and in the next few days, we're going to want to reduce those exposures, but there's going to be some exposures that occur. But thereafter, when we move into the recovery phase, whether that be 2 days, 3 days, 10 days later, we are going to be much stricter, all right, in terms of making certain that they wear their PPE no matter how uncomfortable the respiratory and skin protection is, and in limiting the number of hours, because we now have evidence that duration matters, right?
Right.
But what we have to do is also couple that with the ability to still do the recovery effort. And I think that's where it's important that our message is properly crafted. We're not taking you out of the recovery effort. We're substituting you with another FDNY member for a while. We're giving you a rest. And then when you go back in, we're going to make certain that you're wearing all this personal protective equipment. Now that's a huge challenge though, because as you know, the personal protective equipment is weighty, it's encapsulating, you need a lot of different levels of personal protective equipment for different tasks.
By the way, has some of that personal protective equipment, in particular respirators, but other important elements, you think there's been improvement in the last 15 years?
I think there's been far greater accessibility and far greater training in the last 15 years.
Right.
We have a lot of different types of personal protective equipment now, and we train in all of them. So I think there we've made a huge accomplishment. Do I think that we need to do more in terms of the design of these PPEs? Absolutely. We need to make them much more comfortable. We need to improve the ability to communicate through them. We need to have interoperability where if a filter needs to be replaced and you can't find the filter from that manufacturer, you can use a filter from another manufacturer. Of course, that has huge challenges in terms of proprietary rights. But if you can't, then what you're faced with is buying a whole new PPE, right, which can be very expensive, and then fit testing and retraining in it. So we need to really improve the interoperability between different manufacturers. And I know NIOSH and OSHA are working on that, but it's very difficult.
One of the elements that I haven't heard from you yet is telling people that we have exposures that we don't understand, and we can't guarantee you we're safe. And I think that was a major problem at 9/11. Within a week or two afterwards, some communication from federal officials that to the broader community, not so much ground zero, but whatever, that the air was safe to breathe. And I think that what we have to use now is the precautionary principle, which is that these exposures, we're not sure what they are or what they'll do, but we're going to assume they're hazardous until proven otherwise. In other words, we're going to protect first when we're uncertain. And that element has to be there.
And that's exactly what Dr. Kelly and I and the fire department did from day one. People came out of those towers.
Right.
They came out of the subsequent rescue events, and they said, this doesn't smell, taste, or seem like a typical fire. This is different. Am I safe? And we said, we don't know.
Mm-hmm.
All right. And they said, well, we've got to do our work. And we said, we'll be there for you when you come out. And that's what the World Trade Center Health Program is. It's an understanding that we made a commitment to every one of these people because we didn't know, they didn't know. And you are absolutely right. When you say something, your credibility is on the line.
One of the problems going back September 11th was that there was a great pressure from the city to clean up that site as soon as possible. And I remember the mayor was very proud that it was cleaned up in less time than predicted. If you prize health and safety of the people working there, that schedule is going to slow down. And my question is how are we going to get the leverage we need to ensure that people are properly protected, thereby slowing the work down and thereby delaying the moment when business as usual can be resumed?
You know, I'm not convinced that it's going to slow the work down. I think we can achieve both, all right? I think that we can provide personal protective equipment, that we can do on-scene training, that we can fence a site, that we can use electronic GPS identification cards, which are now dirt cheap, to know where people are, to provide them with a certain number of hours where they're in the site and out of site. What I think it requires is supervision,
Mm-hmm.
right? And what I think the World Trade Center has taught us is that you need to supervise not just the construction or deconstruction of a site, but you need to supervise the health and safety of the site. Right? That's where I think we didn't do what we should have done. All right? That's where we need to transition from a rescue effort, all right, where we're there to rescue, to a recovery effort where we're there to recover but to remain safe.
Right.
I think there was a huge amount of attention, by the way, on musculoskeletal injuries. Very few people at the World Trade Center site during the recovery effort had broken legs or crush injuries. I'm not talking about during the collapse, I'm talking about thereafter. That's an amazing testimony to supervising that portion of health and safety.
Right, that's true.
And because we were successful at that, I believe we can be successful at a wider range of exposure health and safety preventative efforts. Now we know we have to be.